Okay, hello.
Hi.
My name is Madison. I'm a nurse practitioner here, and today I'm going to be doing a full head-to-toe exam on you. Okay?
Mm-hmm.
I provided privacy, I've washed my hands, and we're going to get ready with the exam.
Okay.
So at any point during the exam, if you're having pain, if you're uncomfortable, just let me know, and we can stop or modify.
Okay.
So I'm going to ask you a few questions first.
Okay.
Can you tell me your full name?
Megan Crisanti.
Okay. Can you tell me where we are right now?
In the doctor's office.
Okay, great. And can you tell me the date and the year?
It's October 12th and it's 2021.
Okay, good. So your general appearance looks good, you look well groomed, and you looks like you take very good care of yourself, clean, well nourished. And then throughout the exam, I will be looking at the skin, determining if it's warm, there's no lesions, you know, it's appropriate skin color.
Okay.
Just by looking at you now, looks pretty good.
Okay.
Okay, so we're gonna do head to toe. I'm gonna start with your head. I'm not good. You can do it. Okay, so I'm gonna first just palpate your scalp. Okay.
Okay.
I'm going to just feel around, let me know if that's uncomfortable. I'm gonna be looking for lesions or masses. So I'm just gonna tilt you forward.
Okay.
Looking for lesions and masses. Feels pretty good.
No pain.
No pain, good. I'm gonna be looking at your hair distribution.
Mm-hmm.
Doesn't look like you have any bald spots, even hair throughout your whole scalp.
Okay.
Everything looks good from that standpoint.
Okay.
So then I'm going to go to your face. So just look at me. I'm gonna look at your face and see that it's symmetrical.
Mm-hmm.
Your eyes are symmetrical to your nose, which is symmetrical to your mouth.
Mm-hmm.
And your ears and everything looks within symmetry.
Okay.
Okay, so I'm gonna check a few cranial nerves now.
Okay.
So I'm gonna have to do a few funny things. I'm gonna have you raise your eyebrows, close your eyes very tightly. Okay, and then I'm gonna have you puff out your cheeks. Perfect. Smile for me, and then give me a frown. Good, and then show me your teeth. Perfect. I'm gonna check your temples.
Mm-hmm.
They're nice and elastic.
Mm-hmm.
And then I'm gonna check your temporomandibular joint. So open up and then just move your jaw side to side. Okay, good. Then I'm gonna check sensation. So I'm gonna do this, I would do this bilaterally for the sake of the exam. I'm just gonna do it on one side of your face.
Okay. I'm
I'm gonna close your eyes and you tell me if you feel something soft or sharp.
Okay. Soft. Sharp. Sharp.
Okay. I'm gonna do it again.
Sharp. Sharp. Sharp.
Okay, good. Excellent. Okay, so next we're gonna move to your eyes.
Okay.
Okay, so I'm gonna do a few things. First, I'm gonna check that they're equal, round, reactive to light. So I'm gonna put shine a pen light in your eyes.
Okay.
Okay, so I'm gonna come from over here.
Okay.
Just come right in the, perfect. And then I'm gonna come over here. Perfect. Okay, then I'm gonna check your eye movements and your peripheral vision.
Mm-hmm.
Okay, so first we'll do the eye movement.
Okay.
So I just want you to follow my finger
Okay.
with your eyes.
Okay.
Okay, great. A few more. Okay, so your eye movements are smooth, bilaterally, and they can follow my finger.
Okay.
Next, I'm gonna look for your peripheral vision. Okay, so I'm gonna stand right in front of you.
Mm-hmm.
You're gonna look either right at me or like something fixed on the wall,
Okay.
and I'm gonna tell me when you see my wiggling fingers.
Okay.
Okay?
Mm-hmm.
There. Okay, great. So the next I'm gonna take my ophthalmoscope. I'm going to shine this into your eyes.
Okay.
Okay, so I'm gonna be looking for a few different things. So I'm gonna come kind of close to your face. Let me know if this is hurts your eyes or anything. Okay. Take my glasses. Okay. Okay. So red reflex is present. We can visualize the optic disc, which is circular. Your sclera is nice and white. No abnormalities in your eyes. So we're gonna come do this as well. Okay. Here we go. Okay. Pretty much the same on the other side. Reflex is present. Optic disc is there. Circular. Thank you.
Mm-hmm.
Your eyes look white bilaterally in your sclera. Our disc looks good. There's no discharge. Have you had any trouble with your eyes?
No.
No. There's no redness. Nothing like that. Okay, good. So I'm gonna put this back over here. Okay. Next, we're gonna move to your ears. Before I do that, we're gonna check your visual acuity. So I have a Schnellen chart right here.
Okay.
So you're gonna cover one eye. I'm gonna point to a line and you can tell me if you can read it.
Okay.
So we're gonna be testing your left eye this time. So tell me this.
E.
Okay, tell me this one.
LDO.
Okay, and then go ahead and tell me, where is, go ahead and tell me this one.
OZPCELTD.
Okay, and how about this one? Here.
Above line. EDOPTFLC.
Okay, so go ahead and now cover your left eye. I'm gonna check your right eye. Tell me this.
E.
Okay, tell me here.
LVO.
Okay, and then tell me down here.
OZPCELTD.
And then tell me this line.
EDOPTFLC.
Great, so you have 20/20 vision in both eyes, which is awesome. Okay, so now we're gonna go to your ears. So first I'm just gonna pull on your pinna.
Mm-hmm.
Okay, come up closer, okay. First we're gonna pull on the pinna.
Mm-hmm.
Your ear looks great, the color is good. It's good, very firm. I'm gonna push on your tragus.
No pain.
No pain. Doesn't look like there's any discharge. So that's great. Do the same thing on the other side. Can I see? They can see you. Okay. So I'm gonna pull the pinna, push on the tragus, no discharge.
No pain.
Good. Okay, so next I'm gonna get my thing ready. Okay. So I'm just gonna look. I'm gonna pull the pinna upward and then look in your ear. Okay. So your tympanic membrane is gray and pearly white. Smooth. No abnormalities.
Okay.
We'll do that over here as well. Okay. So, okay. So tympanic membrane is gray and smooth. No abnormalities. Okay. So now I'm going to test your hearing. Okay.
Mm-hmm.
I'm going to do a few different tests, the Weber and the Rin test. So the first one, I'm going to do the Weber test.
Okay.
So I'm going to hit my tuning fork. I'm going to place it right on top of your head, and you let me know if you hear it equally on each side
Okay.
or greater on one side. So you
Okay.
can let me know.
Sounds the same.
Sounds the same on both sides.
Mm-hmm.
Okay. Next, we're going to be using the tuning fork. So this is the Rin test.
Okay.
I'm going to have to use this. So I'm going to hold this right behind your ear. Should we do it this side? I'm going to hold this right behind your ear. Okay.
Mm-hmm.
Tell me when you stop hearing it, and then I will be moving it to the front of your ear.
Okay.
Tell me when you stop hearing it there.
Okay. Okay.
Okay.
It lasted a long time.
It did. Okay, great. So now that we've done your ears, we're going to move to your nose.
Okay.
First, we're going to check your smell. I'm going to have you close your eyes. I'm going to hold something under your nose. Let me know what you smell. Okay.
Oh, it's a top scent. Some type of fruit.
Okay, perfect. Okay, then I'm just going to test the patency. So I'm going to have you hold one nostril,
Okay.
sniff through the other, and then do it on the other side. Okay, and then I'm just going to look at your nose. Okay, so mucus in your nose looks not very dry. You don't have any septal deviation. Do you have any discharge or any trouble? Okay, good. So now that we've done your nose, I'm going to move to your mouth. Okay. So for your mouth, I'm going to have you open your mouth. Okay, good. So the mucus looks pink. It looks that you have, doesn't look dry, looks very moist, which is good. So I'm not going to actually depress your tongue because I think it's been previously used, but I can use a tongue depressor to check for the strength of your tongue. But first I'm going to have you stick out your tongue and say ah for me. Perfect. So the tongue is midline when stuck out, and your uvula is, it moves on phonation, so that's great.
Okay.
So the next thing we're going to do is I'm going to check your protrusion of your tongue. So what you're going to do is you're going to stick your tongue and onto the sides of your cheeks. Perfect. Awesome. Okay, next I'm going to have you stick out your tongue, move it side to side, up and down, and let me see underneath your tongue. Okay, and let me just see your teeth. They look straight, clean. Perfect. Okay, so we did all that. And now we're going to move to your neck and your shoulders. I'm gonna palpate your sinuses. So I'm gonna palpate your frontal sinuses and your
No
maxillary.
Nope.
No pain?
Nope.
Okay. Excellent. Okay. So now I'm gonna move to your neck.
Mm-hmm.
I'm gonna palpate your lymph nodes. All the way down your neck. Just your clavicle here, above your clavicle and below. No tenderness.
Mm-hmm.
And none of your nodes are swollen or present, which is great. I'm gonna take my stethoscope. First, I'm just gonna palpate your carotid artery. It's elastic on both sides. And then I'm going to auscultate with the bell of my stethoscope. Okay, so no brewery present, which is great. And then I'm gonna check for your thyroid gland. So what I'm gonna do, just lean forward and stay like this because we're gonna check your chest next. I'm just gonna feel, I'm gonna have you swallow. Okay, good. So no nodules, feels like your thyroid gland is nice and smooth. Okay, so you can sit. Okay, perfect. I'm also gonna check your neck movement. So side to side, chin to chest, and then hyperflexion, chin, perfect. And then rotate it for me. Okay, any discomfort there?
No.
Okay, I'm gonna check your shoulder strength. So just go ahead and shrug your shoulders.
Okay.
Up and down, okay. And then against my resistance. Okay, good. While we're here, I'm just gonna check for your neck strength as well. So I'm just gonna push against my hand. Okay, great, and over here. Awesome, okay. So now we're gonna check the posterior chest. For the sake of the exam, I'm gonna have Megan keep her shirt on. In other situations, I would have the patient remove their shirt so I could have a better look at the skin, but I'm just gonna pull it up a little, just so I can see. Skin looks good, there's no lesions, it's warm to touch, good color. Okay, so I'm gonna pull this back down. So first, I'm just going to be inspected. So then I'm going to look for chest expansion. So I'm gonna go to the T9 and the T10 of the spine, and I'm gonna check. So go ahead, deep breath. So bilateral equal chest expansion on inspiration. Okay, great. Next, I'm gonna check for tactile fremitus. So I'm gonna have you say 99.
99.
Again,
99.
again,
99.
okay.
99.
Awesome, tactile fremitus is present. Next, I'm gonna percuss. I'm gonna be tapping on my middle finger while it's laying flesh on the back of her chest. Okay, sounds good and resonant. I'm sorry. And next I'm going to auscultate the back of her chest. Deep breath. Deep breath. Okay, so the lung sounds clear bilaterally and there's no signs of crackles or wheezing, so it sounds really good, and your work of breathing is very easy. So now I'm going to check for your CBA tenderness. So I'm going to do some things where I hit the back of your kidneys.
Okay.
Okay. So let me know if this hurts.
Okay. Nope. Nope.
Okay, great. So now I'm going to have you sit forward. I'm going to check the anterior chest. Okay. So pretty much the same thing that I did before. I'm going to just inspect the anterior chest for the sake of the exam to keep Megan covered up. I'm not going to have her remove her shirt, but skin looks good, no lesions. It is warm and the appropriate color. Okay. So then I'm going to look for tactile fremitus on the front. So just say 99.
99.
Okay, great.
99.
I'm just going to come under here.
99.
Okay, good. I'm going to percuss like I did earlier, using my middle finger. Okay, really nice. And then I'm going to auscultate. Deep breath. Okay, great. So next we're gonna do your heart. Okay, so I'm gonna have you lay. We're gonna check your jugular venous distension. So use your pillows. Okay. So lay back for me, and I'm gonna measure your JVD. Okay, so that's not present, which is good. Okay, so the next thing we're gonna do is we're gonna just inspect the chest, and I'm going to palpate your heart at the base, the apex, and the left costal line. Okay. So I'm just gonna feel kind of around your breast here. Let me know if this is uncomfortable. Okay, I can see. Okay, good. Okay, everything feels normal. Next, I'm gonna listen to your heart sounds. Okay. The pulmonary, aortic, Erb's point, tricuspid, and the mitral valve. Okay. I'm gonna auscultate with the bell. Okay, so S1 and S2 are present on the auscultation, and there's no adventitious sounds like murmurs, there's no clicks, there's no gallops, which is great. So carefully, I'm gonna have you lay on your left side, and I'm going to listen and palpate the apex of the heart. Assessing for the PMI. Okay, good. So both are present. And they sound good. No, nothing that should be worrisome. So very good so far. Okay. So next, I'm going to do your abdomen. Okay. Okay. So first, I'm gonna listen. I'm gonna start in the right lower quadrant and work my way around the 4 quadrants. Then I'm going to be listening to the aortic, iliac, femoral, and the renal arteries as well while I'm doing this. So I'm gonna put it all together in that sense, and then we'll move on. Just gonna sneak up here. Listen to your femoral artery. Okay, great. So you have positive vowel sounds in all 4 quadrants, and I listen to the aortic, iliac, femoral, and the renal arteries, and there's no brewery, which is great. So next I'm going to percuss. We should be here, tympany, and there could be some dullness depending if you're over a certain organ. So we're just gonna percuss around. Dullness, actually. And next I'm going to do light and deep palpation, looking for any enlargement of organs. Sorry, my hands are really ticklish. You're ticklish? Okay,
Yeah.
I'll be.
I just don't want, I want to warn you. I always tell my doctors.
Okay, and then some deep palpation. No pain. No pain. Organs feel good. No obvious enlargement. Okay, good. Okay, so now that we've done your abdomen, I'm going to have you sit up, and we're going to move to your arms. Okay. So first I'm going to test your sensation like I did before. I'm going to use a Q-tip here, and I want you to tell me if you feel something. I'm going to have you just pull this up. Tell me if you feel soft or sharp. Okay, close your eyes. Soft. Okay. Soft. Yeah. And the next one? Sharp. Okay, sharp. Perfect. Okay, so your sensation is very good bilaterally. So I'm looking at the skin, of course, appropriate color, hair distribution, there's no lesions, there's no abnormalities, okay? So next, we are going to palpate your joints. Okay, I'm gonna do your shoulder, your elbow, your wrist, and your fingers. Okay, so I'm just gonna do it bilaterally. Any discomfort? Nope. Okay. Palpate your elbows. Okay, your wrists. And then I'm gonna palpate your fingers. I'll just do your left hand, but I'm gonna feel each finger. You have good knuckle, skin folds over your knuckles, which is appropriate. And then while I'm here, excuse me, I'm gonna do some capillary refill, which is less than 3 seconds. And there's no obvious edema, which is good. Okay, so next we're gonna check strength. So starting with your shoulders, I'm gonna have you put your arms out like this. Okay, great. And then we're gonna have you flex your elbows bilaterally, so up and then down. Okay, so same with your wrists, just flex your wrists. Do some pronation, kind of like this. Okay, and then just move your fingers up and down. Okay, so now I'm gonna check strength. So put your shoulders back up and move up. Okay, good. And we're gonna go back down and I'll just do it on this arm here. So you're gonna bend and pull against me. Okay, great. We're gonna check your wrist, so just lay it flat. I'm just gonna put my hand in your hand and then try and flex your wrist. Okay, great. And then with both hands, pull my fingers. Pull, pull. Perfect. And then we're gonna do your rapid movements. So just palm and then up. Okay, great. You do that beautifully. I think that's everything with the arms. You have strength 5 out of 5. And you did really well with the movement in your joints. Again, no pain and no discomfort. Okay. I'm gonna just quickly check your lymph nodes as well and your pulses. Okay. So I'm gonna check your lymph node, no tenderness. I'm gonna check your brachial pulse, your radial pulse, and your ulnar, which are +2. I'll do it over here as well. No tenderness in the lymph nodes, your brachial pulse, good. Radial, and your ulnar. Okay, awesome. So now that we've done that, we're gonna move to your hips. Okay, so for this, I'm gonna have you, we're gonna do your legs. So we're gonna start with range of motion, hips, knees, ankles. I'm gonna inspect your skin, again, smooth, appropriate color, warm to touch. I'm gonna check your sensation as well. We're gonna do some movements and then I'll check your strength. Okay, so let's do your sensation. Just try and roll up. Yeah. Here, and then here. Okay, so I'm gonna have you close your eyes again and then tell me if you feel soft or sharp. Okay. Soft. Okay. Soft. And here, sharp. And here, sharp. Okay, great. So sensation is good. No present edema. Skin looks good. I'm gonna slip off your sock, one sock to check your capillary refill. Okay, less than 3 seconds, which is great. Get your sock back on. Sorry. Okay, so once you have your sock on, I'm gonna have you lay down and we're gonna check your range of motion of your hips. Okay. For the sake of the video, we're only gonna do your left side because it's more visible to the camera, but for in a real exam, we would be checking bilaterally. Lay down. So you can lay down. Okay, so I'm just gonna palpate the hip joint. Okay, I'm gonna palpate your knee. I'm gonna palpate your ankle and your toes. Okay, so to check your range of motion of your hip, I'm gonna have you pull your hip out and then towards your body. So abduct and then abduct. Great, so bring your knee up to your chest. Perfect. And then I'm gonna have you kind of straighten it out just over, and then we're gonna come back over here. Any discomfort? No? Okay, great. So then I'm gonna have you straighten your leg. I'm just gonna add some pressure to check for the strength here of your hip. So if you wanna try and move your hip back out. Okay, so strength's 5 out of 5, awesome. So go ahead and sit up. We're gonna check your knees now. Okay, so I'm actually gonna have you stand. You can stand right in front of me. So bend your knees. Like this. Like bend up. Like put it up and then flex. Okay, and the other one? Okay, great. So then I'm gonna check for strength while we're here. So just go ahead and put your knee back up and try and flex it. Okay, good. And here. Go ahead. Good. Okay, so 5 out of 5. You can sit back down. We're gonna move to your ankles and your feet. So for your ankles, I'm gonna have you flex your foot, point, and then do some pronation. So bring your soles of your feet together and then bring them back out. Like this.
It's hard.
Like that. Yep. Okay, so good movement of your ankles, no discomfort? No. Okay. So then for your toes, I'm just gonna have you point your toes, flex your toes. And then for strength, we're gonna do the pedal. So pull towards you. Bring it over here. Okay, pull towards you. Okay, push on my feet like a pedal. Okay, great. So really good range of motion, 5 out of 5 for all your extremities. There's no edema. Okay, I think we're good with that. So the next, we're gonna do your gait. Okay, so I'm gonna have you stand over here. I'm just gonna have you walk towards the camera. Okay, turn around, come back this way, sorry. Okay, then we're gonna do the Romberg test, so just stand there, heels together, arms out, if you can. Okay, and just close your eyes. Okay, good. So I'm just checking your balance there. You sway only a little bit, but you do really well otherwise. Then I'm gonna have you hop on one foot, which is a little silly, so hands down, eyes open. Just do one hop on each foot, okay? Okay, great. So you have a steady gait, you have good balance, and it seems like you don't have any trouble walking or moving, which is great. So now we're gonna check your spine now I have you here. So the curvature of the spine, there should be some concave and convex. It should make an S shape, which we do see here in Megan, and then we're gonna check the range of motion. So face the camera for me. I'm gonna have you bend side to side, just like that, right? Then go down and touch your toes. I'm gonna just check your spine here. Feels very straight and it feels like your vertebrae will stack normally. So come back up, no signs of scoliosis. Okay, great. So then just twist. And then turn to your side and try and turn fully to your side. Oh, and try to hyperextend your back. Okay, how does that feel?
It's visible.
You're able to do it?
Yeah.
Okay, cool. Okay, so your full range of motion in your spine and everything looks normal, so that's great. So next we're just gonna finish off with some neurological exams. So you can go ahead and sit down. I'm gonna check your reflexes as well. So I'm gonna do it for your arms and your legs.
Okay.
Okay, just lean, yeah, there we go. So for your arm, I'm just gonna bring it right here. Just try and make it a little perfect. Okay, nice. I'm gonna check your reflex here as well. And then I'm gonna check it right on your wrist. Perfect. So we're gonna do the same thing here. Just have your arm relaxed. Ooh, that was good. And then and then right here at the wrist as well. Okay, so now I'm gonna go down to your lower extremities before we get to the neurological exam. I'm gonna do your patella. Ooh, I love that. Ooh. And then we're going to do your Achilles. Okay, when I'm down here, I'm gonna also check your pulses, okay?
Mm-hmm.
So I'm gonna check your dorsal pedis, posterior tibial, strong, popliteal, and then I would check your femoral as well. +2 all around, so that means you have really good circulation going down your legs, okay?
Mm-hmm.
So we did your reflexes, we did your circulation, so we'll do the neurological. Oh no, where's my paper clip? Okay, so I'm gonna give you, is there? Whoa, 6. Okay, so I'm gonna give you 3 words.
Okay.
Then we're gonna do the neurological exam, and then when we're done, it's only a few questions, I'm gonna have you read those words back to me.
Okay.
So I'm gonna say house, baby, and dog.
Dog. Okay.
Okay, so I'm gonna do a few things here. Give me your hands. Take my little pose. Okay, so I'm gonna have you close your eyes. I'm going to trace something out on your palm. You let me know what it is.
Okay. A.
Okay, great. And over here. 8. Okay, great. I'm gonna give you an object. Keep your eyes closed and identify it for me. It's a paper clip. Okay. And on this side as well.
Paper clip.
Okay. Okay, great. So then I'm gonna have you just read back those 3 words for me.
House, baby, dog.
Great. So I think that concludes our head to toe exam. Do you have any questions for me?
No.
Okay, great. You did a great job. Thank you for
Thank you.
being here today.
Thanks.
And I think we're gonna go ahead and stop.